Dr. Green, you called me into your office.
Yeah, I was wondering if you could take Edith Claus's file in room 215. She just had a hip replacement done,
Okay.
so I'd like you to work on the dressing aids for it as well as the precautions.
Okay.
Alrighty.
Hi, Ms. Claus. May I come in?
Yeah.
Hi, my name's Sam. I'm an OTA PTA student at Durham College. And I'm Dr. Green's assistant, and she sent me in to work with you today.
Okay.
And you are?
Lillian, her daughter.
Nice to meet you.
Me too.
Today, I'd like to work on your hip precautions and some dressing exercises. Would that be all right?
Mm-hmm.
And is it okay that Lillian's in with us today?
Yeah, whatever. What's your name again?
My name's Sam. I'm Dr. Green's assistant. And we're going to work on some dressing exercises. With the dressing exercises, there's some risks and benefits. Some of the risks is you might feel nauseous or dizzy when getting up, and you might feel slight pain. But to prevent that pain, we're going to go over your hip precautions so you don't break them. Okay? Mm-hmm. And then this is also going to get you up and independent, so you can get ready to go home, and you can start doing things at home on your own. Is that all right? Okay, so some of the aids we might be using is a sock aid. It's like a tube. It's going to help you put on your socks, and a reacher, which is going to help you pick things up off the ground. Is that all right?
Yeah.
Do I have your consent to move forward with the treatment?
For sure.
Okay, so do you remember your hip precautions?
No, you have to go over them.
Okay, if you look at your daughter right now, she's sitting in upright position. So she's bending at her hip at 90 degrees.
Mm-hmm.
We can't do that with a hip replacement. So you can't bend down and you can't sit straight up, but you can lean back and sit up if you'd like. Just to be careful, because the hip could pop out of the socket and we'd have to because you've dislocated, you'd have to put it back in, and that could be also painful as well. You can't cross your legs or at your ankles, because then that would be breaking a hip precaution as well, and you're not able to rotate at the hip, like that. All right? Is that okay?
Yeah.
Can you repeat at least one to me?
Can't cross over my legs.
Perfect. Okay. So now we're going to work on some of the dressing techniques, okay? So we're going to get you up in a lean back sitting position, and we're going to work with some of the gait those aids, okay?
Okay.
Go back to where you were sitting before. All right. Was the treatment okay today? Was there any pain during treatment that you didn't let me know about?
No, I just want you to get out of here.
Okay. Well, I'm going to wrap up quickly. And do you have any questions for me?
No.
Is there any questions you'd like to ask?
I have a question. Just when she is discharged, is there anything that I can do to provide her help while we're at home?
Yes. My OT, Dr. Green, will come in after. I'll let her know that you have some questions, and she can come in and give you some of the exercises and teach you how to do them, so you can help your mom and help her become independent as well.
Okay, awesome.
Yeah. So would that be okay if Lillian was to help you with some of your exercises at home when you're discharged?
Yeah.
Perfect.
Awesome.
How's your hip feeling right now? Is it
Fine.
It's fine? Okay. Well, I'm going to go and report back to Dr. Green, and then she'll come in shortly and talk to you guys, okay?
Okay.
Awesome. All right.
Thank you.
No problem. You guys have a good day, okay? All right. Get some rest.
Goodbye.
I just finished up with Miss Claus. Yeah. I have her file and everything here. We just went over the hip precautions. She seems to remember them quite well.
Yep.
She is quite tired after the treatment, so she didn't want to go over them again. But the first time I went over them, she kind of remembered. There's just one, the rotating at the hip. She didn't seem to remember that as well, but I still went over them with her, and she seemed good. And Lillian was in with me today, her daughter. She seems very interested in helping her mom out. So she wants to know if there's any techniques that she can use to be able to help her mom at home with dressing and stuff. Yeah. And also, Miss Claus is wondering when she's going to be able to go home. I don't know if she wants to give that information or not. And then we went over the dressing techniques. So we just discussed the reacher and went through that with her. She seemed to tolerate it well.
Excellent. So all the files done, all the written
Yes.
documents? Alrighty, so I'll just finish this up and then I'll go talk to her about all that information.
Perfect.